This is a podcast where real doctors discuss fake medical emergencies. That means that unless your environment is as toxic as William McKinley High School, this podcast is not medical advice. If you need medical advice or medical care, please contact your doctor. Also, this episode does deal with sensitive topics including sexual abuse, mostly with regards to the ethics and requirements of reporting that kind of abuse. Just wanted to give listeners a heads up.
Hi, everybody. I'm Jackson Bain.
I'm Johnny Kolosinski. You might remember me from such podcasts as Nip Truck, a Pimp My Ride for tractor trailers.
Oof.
This is Hi Everybody, a Bad Medicine podcast. Every week we talk about what Hollywood gets right and wrong about medicine and how the body works. You can find this podcast online on Facebook, Instagram, and Twitter at hieverybodymd.com or by visiting www.hieverybodymd.com on the World Wide Web.
You can also call us on your telephone or text us on your cellular telephone at 530-DOCTORB. That's 530-DOCTORB. The B stands for Birthmark, which was one of our B plots in this episode.
The B stands for B plot.
Oh, God. That B plot, though, really made me cringe hard.
Yeah. We are watching season 1, episode 8 of Nip Tuck, which was Cara Fitzgerald. But before we get into the episode, a little bit of housekeeping. First off, I want to let you know that the time for our WonderCon panel has been announced. It'll be Saturday, the 27th of March at 5 p.m. Pacific, 8 p.m. Eastern. No idea what time that is Zulu.
No. You can find more information about it on WonderCon, I think, wondercon.com.
Yep. And we will also be doing, Jackson and I, a Reddit AMA on Wednesday the 17th, St. Patrick's Day, roughly 10 a.m. By roughly, I mean exactly. So show up tomorrow if you're listening to this on the day we launch it. Ask us some questions, give us some updates, and help us spread the word.
Yes, please. We would appreciate it a lot. Especially after talking about an episode like this.
Yeah. And one last thing before we get into it. I want to say thank you to those of you who have been talking about the show and helping spread the word. And also a shout out to Rebecca, who let me know that she was curious exactly how many of the podcasts that I mentioned at the beginning of the show are real.
The answer is 0.
The answer is none. 0 is a number.
I think 0 for now. You never know.
I brought up a couple. I brought up when I guessed it on a couple of them. So yes. Maybe 3.
Sure. Let's go with that. I'm not 100% sure how many of them are real, to be honest. Some of them sound realistic. Not Nip Truck, though.
Not Nip Truck.
No.
My favorite is still dubstep.
No. Nope. Nobody, no.
But Jackson, why did you pick this episode of Nip Tuck? It's a show that I had never seen before.
So Nip Tuck was actually suggested by one of our listeners. So I thought this would be a great one to discuss. So kind of going through the list of episodes, this episode in particular deals with a couple topics that I deal with on a daily basis, but also one topic in particular, which deals with family beliefs that is I've only had to deal with one time, and it is a very, very challenging case.
Yeah. And there was a content warning at the beginning of the episode that Jackson didn't hear. But for those of you who skipped over that, we're going to talk about things like abuse in this episode. So heads up on that. It's going to be a fun-filled romp.
Yeah, it's, as your wife said, a feel-good episode.
Yeah.
Why did I pick such a feel-good episode? This one's a good one just to discuss like medicine, but also kind of ethical issues that sometimes I have to deal with in the hospital itself. But the A plot of all of this deals with the namesake character, Cara Fitzgerald, who gets hit by a car by Sean's kid.
Mm-hmm. Sean's one of the 2 plastic surgeons that are the lead characters of the show.
Sean McNamara and Kristen Troy.
Mm-hmm.
Both fine, upstanding gentlemen.
Yeah. As are all Ryan Murphy characters.
Ryan Murphy does like to write about troubled characters, I would say. Mm-hmm. And I believe this is one of the earlier shows he did. I'm fairly sure it's one of the...
It was definitely before Glee.
Yes. And this one was like a crazy show. One thing I did want to mention before we started all of this is the whole concept of the Shabbos Goy. When I remembered like rotating through certain Jewish hospitals and remembering on the Sabbath, the Sabbath elevators. And I don't know if you've ever dealt with that before.
I have not.
So on the Sabbath, you're not allowed to do any kind of manual labor.
Mm-hmm.
So there are certain elevators that were set to Sabbath mode that would run and stop on every single floor. So you can get on without having to press a button. And then it would stop on each floor, open up, you can get off or wait for the next floor. Newbie me didn't realize that that was the elevator that was designated for this. So I got on there. I'm like, who pressed all these buttons?
Ghost elevator.
Why do I have to wait on every single floor to go through? So when he mentioned that, I'm like, okay, this is already triggering me for my medical past, I should say. But in this situation, he was driving the car for his Jewish friend, arguing over the radio, letting his letting his Jewish friend press buttons on the radio to change the music. That's a no-no.
That's a bad Shabbos Goy.
That is a very bad Shabbos Goy. And then they accidentally hit this Cara Fitzgerald person, but didn't realize they hit her.
Mm-hmm.
That was confusing to me.
They were high.
Yeah, but also was the car high because there was no like spider webbing of the glass or blood anywhere. The car couldn't have been that high.
Right. And they knocked her clear off the road and into a ditch, which is why they didn't see her. So they legitimately thought that they hadn't hit anyone.
Yeah.
Until they found out that someone was hit.
But you would think that if you got out of the car, there would be a dent in the bumper or like at least a crack on the windshield because they were going pretty darn fast.
Yeah, it was a classic car. So it was like this is not a 2021 Civic with crumple zones.
Yes.
It was all real American steel.
But even
except for it might have been Italian.
Yes. But even then the bumper should have crumpled at least, right?
Mm-hmm.
Also, it's not real American glass.
That's true.
So that should have shattered too. And then I always ask the blood.
Mm-hmm.
There was none. And, even thinking about my last 2 weeks of work with all my pedestrian versus automobile incidents, something always gets hurt. And there's always something broken, at least considering the level of people getting hit.
Something in the car, you mean?
No, something on the person too.
Oh, okay.
Well, I guess both. Car versus person. Car usually wins in this situation. And I would have expected her to be in a bigger mess than what they showed.
Wow.
Yeah. And they did show like the next scene. She was in the hospital and she was, I guess, in the ICU, maybe.
Yeah.
And they bandaged her whole face up, but they said she never woke up. And that's one of those situations where if you're not waking up, that means you're probably not breathing well. So I'm surprised they didn't put a tube in her mouth.
Mm-hmm.
So, I mean, it's my standard complaint of ICUs in general. Not enough like tubes, not enough lines and all that stuff. And not enough monitoring in that general.
Right. And she was the one whose mother was a Christian Scientist and she was a Christian Scientist. Yeah. And so
Christian Scientists are like a very difficult, you want to respect everyone's like, how do I say it? Like respect their will and all that stuff too. Right. And a lot of times Christian Scientists do not end up in my hospital. And the only time they end up in the hospital is someone else who is not part of the family calls 911 to bring the patient into the hospital. Like in a car accident situation or a pedestrian versus automobile situation. That's usually how they end up in the hospital. And I don't know, have you ever like talked to a Christian Scientist or like know what their beliefs are?
I know a little bit. I know that it is a medical intervention is pretty much across the board a no-no. It's not just no medication, no surgery, nothing that would interfere essentially with God's will far as
and what they
healing.
And what they believe too is that sickness is an illusion. So it is a mental state or a mental error that's not physical. And that's kind of hard to explain too, because I mean, the standard thing that we're taught in medical school, usually for religious stuff, is Jehovah's Witnesses don't allow us to transfuse blood.
Mm-hmm.
But there's always that wink, wink, nudge, nudge situation where if it's a young child who needs blood, they just go, well, if you've done it, you've done it. And it's kind of like the loophole, right? That doesn't exist with Christian Scientists. And it makes it a lot more challenging to make sure you're doing the best that you can for the patient.
Mm-hmm.
And you don't want to overstep someone's religious belief because, you know, you want to respect everyone's beliefs and customs and whatnot.
Mm-hmm.
But when it gets to a situation where there could be permanent damage, it makes it very, very hard. And you're playing a lot with ethics and morals in that situation. And when she mentioned the thing about a healer, I guess, coming in, or a practitioner, sorry, coming in to treat her, that one hit home because we've had situations like this before where a family would request that their Christian Scientist practitioner would come in and pray with them to heal the patient. And here's the messed up part. Those practitioners are allowed to charge. Yeah. That's, I mean, oof. Yeah, and you're trying to respect wishes and whatnot, but if they are charging exorbitant amounts of money, that's scary. It makes me sad.
Yeah.
I get it. Like, you want to follow your beliefs, but that's a rough one. Especially for a doctor, you try to make sure that you're doing the best you can for the patients. And when you see something where you know you can do something, but you can't, it hurts. It hurts a lot. And I think this is the situation here too. So yeah, that's a tough one.
And ultimately what ends up happening, we don't really get a resolution of this plot.
No, but also
we do get the plastic surgeon who doesn't know that he's the father of the boy who hit her.
No.
He comes in and checks her charts and things like that, and says that if you don't operate
in 48
hours, she will go blind.
Oof. I will say you cannot time how long a nerve has to live. It depends on how long the blood has not been perfusing that area, but also the optic nerve, you're worried more about like all the muscles and all the stuff around it too. So I wonder if there was so much bleeding behind that eye that was pushing up. And usually those patients are in excruciating pain. It's something called like, I think it's ocular compartment syndrome. So the way we treat that is we actually crush the tissue on the outside of your eye and then cut it so that we can release the pressure so your eye can push out and relieve some of the pressure in that area.
I'm watching I'm having this conversation with my prosthetic eye out, and
I've never done it on a real patient. I've only done it on cadavers, and they tell us, "Oh, you want to feel the guitar string in the side of the eye, and when you feel the guitar string, you snip it, and then that's what's going to relieve all the pressure in the eye."
Oh no!
Eye stuff is one of those things that creep me out. I'm not gonna.
Yeah.
I mean, especially for you. But
you watched Saw 2 with me.
Oh yeah, I did. It was one of our least medically accurate episodes.
It was our direct follow up to. No, it was actually we gave it a 200% because it was right after Human Centipede.
Oh, right. So we overgraded it.
Yeah,
because we didn't have anything else to compare it to. But yeah, eye stuff grows. The other thing I didn't appreciate about this episode about this whole coma scene is talking about the coma scale.
That she was on a 6 apparently.
Out of what? And what coma scale are we using? If she's on the Glasgow coma scale, she's like 6, which is less than 8, which means she needs to be intubated. Less than 8, intubate. That's the key mantra in the emergency department. What all my residents and all my learners look for is that one patient that has a less than GCS or an 8 GCS less than 8 and needs to be intubated. So I don't understand that whole thing. The other thing too is if she did hurt her neck, which I'm pretty sure she did,
she wasn't immobilized.
It wasn't. It was that soft pillowy kind of restraint that you see patients get put in whenever they accidentally hire a ambulance chaser. That's essentially the ambulance chaser's collar.
Mm-hmm.
That's what it looks like to me. I'm trying to think if there's anything else in that one part that drove me nuts. Oh, here's a fun fact. The mom said she broke bones in her face, and then said, "Did you know there were 14 bones in the face?"
He probably did.
That's actually a true fact. There were actually 14 bones.
I Googled it.
I did too. I wanted to make sure. I'm like, is this the one medically accurate part in this whole episode that I can use to talk about this in a positive light? Yes. Yes, it is. It's the only one. But was there anything else that bothered you in this one scene of Cara Fitzgerald after her getting hit by a car?
There were no other doctors or medical staff or anyone present. Never. He came in, he took a look at her chart. There was no one else there who would have said these things to Mom previously.
Yeah. Also, how did he get operating privileges in that hospital?
Oh, yeah.
Right?
Well, did he say that he did? Well, I guess he would have because he wouldn't have gone in otherwise.
I don't know.
He might have had him.
But he looks like he only works out of his surgery center.
Mm-hmm.
Right? Like, he even looks like he brought that patient to his surgical center to do all of his work. Because that whole operating scene was kind of odd.
Well, that wasn't her, though.
No, that was her, because she had a really swollen face.
Oh, yeah.
That was a really busy day for him, and he did like a bunch of surgeries that day, and I don't understand the whole timeline of this entire episode.
Okay.
But this is not a screenwriting podcast. I just was very confused about how he went from operating on this girl's face to doing the breast
boob job,
operation, and then bounce back and forth. Like, I didn't understand that at all. Oh, the one thing I did appreciate that was medically accurate was him checking the optic nerve. Sorry about jumping around, you guys.
Mm-hmm.
So if you had to check someone's optic nerve, like the part that helps them see, what's the one thing you can do to make sure their eyes are still working? What would you say?
Flashlight.
Yeah. And that's actually what he did, was he checked the pupils. So if your optic nerve isn't working, you wouldn't have the reflexive movement of the pupils constricting. So I think that's what he was checking for.
Mm-hmm.
But by the time that reflex is gone, it's too late.
Mm-hmm.
And I think he was being real cavalier. Sean was saying that, hey, there's only 48 hours left before that girl goes blind permanently. And I don't think you can tell that just from shining a light in someone's eye. And also, your cheekbone doesn't press against that nerve. That nerve is behind your eyeball. Like, it's basically the tether to your tether ball. And that's way like posterior to your eyeball. So if you think about your cheekbone, you need a lot of blood filling up that whole orbital cavity and pushing on that nerve to actually cause that. And not just the fracture itself extending towards that nerve.
Okay.
Yeah. Also, you don't do x-rays of the face to diagnose that.
Because of the fact that's also x-rays of the brain?
Yes. You can't do x-rays of the brain either. X-rays of the brain and the face don't work. That's like when I watched an episode of 50, or was it 1,000 Ways to Die? It was like this really popular show. And they said a couple was having sex on an x-ray machine, and then the guy got irradiated a bunch of times and died from brain x-rays. I already knew that was a fake story. I actually had to go, this is dumb. I know you just wanted to title the episode Sex Ray. Shame. That's the only reason why you came up with that story. That is the fakest story I've ever seen. So you cannot, A, you can't x-ray your brain, and B, unless the fracture is gigantic or there's a jagged piece of bone, it is unlikely that your cheekbone can cause compression of cutting off the blood supply to your optic nerve.
Okay.
Yep. And then since we kind of talked about B plot, I think we should talk about the B plot.
Yeah. Speaking of things driving you nuts, the situation with the B plot is that the other doctor, no, I guess the same doctor. This is still Dr. McNamara.
Mm-hmm.
Has a patient who he removed a birthmark from his scrotum, a big honkin' recognizable birthmark, because the patient said that his fiance hated it and he wanted to have it removed before the honeymoon.
Yeah.
And that he was promised that it would be, completely cleared up, no scar, no nothing, within a couple weeks.
Yeah.
No remnants.
Yeah. Which is a very unreasonable thing to ask of a doctor, especially if it's like a birthmark that's been there your whole life. You can only do so much. And also, if they cut it, there's going to be a scar there from just cutting it, right?
Yeah. So what would the procedure be for removal of a birthmark, non-testicular, just in general?
It depends on what kind of birthmark we're dealing with. Like, is this a meningioma? Then you're dealing with the dilated blood vessel. So you're trying to get rid of that dilated blood vessel and then making sure that there's blood flow still that's going on, right? If it's like a mole, then you just cut it out, but then you also still need to sew up that area. So it would still be suspicious because you'd still have, a scar there, or any other kind of like a wine stain even. You would still cut out that area and sew it up. So the fact that there's still a scar there is still incriminating in that fact.
And the reason we're saying incriminating is that it turned out that this guy was not getting it removed for his wife because he was married to God, because he was a Catholic priest who had been accused by 10 children of
assault,
improper things.
Yeah.
And all of them mentioned this birthmark.
Yeah.
And he got away with it
because the birthmark wasn't there.
Because he was examined and there was no birthmark.
This is straight out of the Michael Jackson case, because they also made him all the kids accused him of assault because they saw a birthmark in his genitals. And I remember watching that press conference of him saying how he had to expose himself so that people can examine him. And this is the same exact situation. And then hearing the two doctors argue whether or not they should come forward and report it was real frustrating to me. Because
in this situation, you have an obvious answer of preventing harm.
Yeah. And also, you're not going to get in trouble because if you document correctly and say, hey, this is a guy who wants this procedure done because he wants his fiance to not be grossed out by his birthmark, that'll hold up in court.
I agree with you, but I don't think that's the argument they were having. I don't think they were having the argument of will this hold up in court? The argument is going to be, we also are the ones who
did the surgery.
I'm sorry?
Did the surgery?
Well, no, who our patients are going to come to us, because they're having an affair, or because their spouse is having an affair and they want to feel better about themselves after that. And that these doctors are exposed to a lot of dirty laundry, especially because they're on FX, and that's what FX is there for, is shows about dirty laundry in 2005.
Yes.
And so the argument was not, we're going to lose our license over this. The argument is, we're going to lose our practice because our patients won't trust us.
But I feel like you should probably be applauded for this.
I agree.
Because you are turning in someone who's going to hurt a lot more people.
That is why the show about this podcast is going to be so boring. Because we won't have those ethical conflicts.
Yes, it is true. It's like when someone asks us to do exams and stuff like that, and we have to release it to the police.
Well, when someone asks me to do exams, I don't have an ethical problem because I haven't taken an Hippocratic oath.
The hippopotamus oath?
I've taken a hippopotamus oath.
You're telling me that clinic you have in the back of your van is not kosher and legal?
It's kosher. It's just not 100% medically, sanctioned.
Accurate.
Yeah, but it's completely kosher.
It's partially kosher.
Yeah,
that counts then. But I don't know why this was a struggle. Maybe it's because I'm not fully jaded as a physician yet. But when I heard the story, I go, the answer is so simple. And I don't know why it's not simple. Medically accurate. Yeah. I'm sure there are doctors out there that have this discussion and think about what they should do. But if you have someone who is on TV flaunting that they couldn't find evidence against them, I almost want to do it out of spite.
Mm-hmm.
You know, like, hey, you thought you got away? No way, man. You're not getting away. You need justice for all these patients or all
Which
these
happened.
victims. Yeah. After he got stabbed in quote unquote the artery that what did Christian say? I know which arteries to cut to kill you. He stabbed him right in the penis artery.
Mm-hmm.
That's not gonna kill him. I mean, cut his femoral. Maybe if he cut deeper, that might have done something. And with the upward slashing motion. I know this is an audio medium and I'm showing the
now
gesture, but you really have to cut through a lot of things to cause a significant amount of damage to injure or harm this patient.
Mm-hmm.
Also, who brings a scalpel to a confessional?
The person who's going to a confessional to extort a confession.
Yeah. I guess.
He had plans. He had a tape recorder and a scalpel.
Was that a tape recorder or was that his like fancy 2005 cell phone?
I thought it was like a either a tape recorder or like a dictaphone.
Remember how small cell phones were? That's what I thought
That's
it was.
true. Like, it could have been. Yeah, it could have been a StarTAC.
It could have been a StarTAC, except for him to call 911, call the police, get that done.
Oh, you're right. He did end up calling the police and saying confess, confess, confess. I thought he was saying confess to the tape.
No, I think I legitimately think that is a tiny baby phone.
I think you're right.
And that's technologically accurate. But that whole thing, that case gave me the heebies real bad.
Yeah.
I did not think that plot was going to go in that direction.
No, not at all.
And I think I watched it with my wife and she was like, are you going to watch the rest of the series? Like, maybe now.
I've heard it's great.
Nip Tuck's great. Fun story. I think I watched this episode with my parents.
Oh.
This is an awkward episode to watch with your parents.
I can't think of an episode of that would be not awkward to watch with your parents.
None of the series is family appropriate. There was definitely there were a lot of in this show. But I think this was the peak age of edgy TV on FX.
Yeah, this was like just pre Mad Men, right around the time Dexter. I mean, none of these are FX shows, but it's like that. We're just getting into we're pre Breaking Bad golden age of television.
It was a lot of prestige television.
Yeah,
and this show's great. I really love Nip Tuck. It does get stupid weird though. After season 3, I would say, after the Carvers introduced, it gets real weird. But it's an enjoyable show. This episode in particular was a good episode, just to watch to see how they approached, I guess, the interpersonal relationships of the surgeons, but also a lot of weird ethical stuff. And I think that whole Christian Scientist thing was big. Also, I forgot to mention the whole Sean doing surgery on his mistress part.
Yeah.
That's a no-no. You should never be doing procedures, especially a cosmetic type of procedure on someone you know. Especially if it's in your own clinic. Funny story, I did a procedure on my friend. He had an abscess on his chest, and I had to get it out, but I did it in my clinic, and I tried to pawn him off on one of my colleagues because, I'm not
because you knew him.
Yeah, but also I shouldn't be doing a procedure on my friend.
Right.
My colleague came back, goes, no, he wants you to do it. And I go, okay, I guess it's me. But I also had a bunch of people in that room too to make sure that everything was on the up and up and I wasn't doing dicey stuff. And also it was not my own clinic. It was someone else's. It was a clinic I worked for, which is totally different in that situation. But it's something to think about. Like, you get compromised if you're doing something for someone else or something for someone you know. You're going to get really into your own head. You're going to mess up a lot more. But also, they know where you live. And they will get very upset about it. But yeah, that one was a tough one too. But Johnny, was there anything else that you were kind of weirded out or miffed about this episode?
Those were, I mean, Not especially, no. I've heard that the show is overall very medically accurate.
Yes.
We didn't see much in the way of medicine. I'm sorry, we didn't see much in the way of plastic surgery
No.
happening.
I will say the one scene where there were two scenes where they did plastic surgery. One was like operating on the face, one was operating on the breast. And of course, the breast one was the one that got interrupted by Christian,
Mhm.
completely breaking sterility. Just like barges in without
Oh, yeah.
anything and just goes, "Hey, you were doing what?" And then that ruined everything for me on that one. But for the most part, it is pretty accurate. And those surgical centers are very like kind of pristine, sterile looking areas.
Yeah, and I noticed that specifically, like that they had. I think I noticed like the covers and everything that they had on everything beforehand. I don't remember if that was in the credits or if that was actually in the show.
I believe there were parts of it that were in the show, and
Mhm.
those
Oh, it was what it was. It was the something that you brought up before. That was the barrier between the face and the patient's face and the surgical area.
yeah, and they used a
That's what
clear
I
one.
noticed.
Yeah, and they used a clear one because you don't want to hide them patient faces in
You
there.
want to know which patient they're operating on because we're watching television.
Correct. Most of the time, those surgeons do not want to see who's on the other side, and it's just like a paper
Mm-hmm.
strip, more or less. But yeah,
One thing I know, I don't think that I noticed that there was an anesthesiologist.
you're right. The silence was me thinking and pondering. I don't think there was. I
The
know there's
silence was also the anesthesiologist not saying anything because they weren't there.
playing on the cell phone.
Yeah.
Yes. In the other room or doing a crossword puzzle. And this time it was doing a crossword puzzle. Nowadays it's playing on the cell phone. I know this because I played an anesthesiologist on TV. We'll talk about that episode in the future. I think the note I wrote the most is why aren't these doctors reporting this birthmark case sooner over and over again? That was frustrating to me. That was super frustrating. If you have a chance to prevent someone from getting hurt, why are you not doing it?
Mm-hmm.
Do the right thing. But again, this is the show about two doctors who definitely don't do the right thing ever.
No.
They are horrible people. That's the whole premise of this show. Good show.
Speaking of premises of shows,
yes.
the premise of this show is that the human centipede bills itself as 100% medically accurate.
Mm-hmm.
If that's the case, and that's our baseline, how medically accurate is season 1, episode 8 of Nip, Cara Fitzgerald?
Okay. I'm gonna give them bonus points for saying that a legitimate fact that there are 14 bones in the face. I feel like you earn credit for that. The whole optic nerve fracture thing kind of lost some points for me, and the whole the whole ICU presentation was frustrating in general. But I will say this is that the medical accuracy of it is almost on par of the human centipede, right?
All right.
It's very close to the human centipede in terms of hokiness and medical adjacentness, I guess. Just like how that's as much of a real word. I'd say 110.
Okay.
110. I think is a fair number to give it because there's a lot of mistakes in it, but not enough that makes me think that it's worse than the human centipede. It's just slightly better. Yeah.
All right. Well, anything else we want to add about it? Anything you do to make it more accurate?
To make it more accurate, I mean, the complaint's always there. It needs more blood. Yeah. When they took off the bandages, the swelling was actually surprisingly accurate for someone who has been covered up for a while. But again, I would expect it to be, and this is from someone who takes off a lot of bandages. It's really hard to take off bloody bandages that have dried.
Mm-hmm.
It sticks quite a bit to their face or to whatever wound it is. It's like when you have a cut and you take off the bandage. Sure, the adhesive is hard, but the minute you get to your cut part and the scabs there, it's really hard to come off. Mm-hmm. Same situation, except she had a lot more cuts. So the struggle of taking off a heavily injured face with a lot of bleeding and trauma that I could make look more accurate, and also increase the stakes too, because trying to take off the bandage to show the mom and then seeing the struggle of taking off the bandage, it hits home quite hard in that situation. And then I think that's the big stuff. Oh, make your ICU look more realistic. But that's a complaint I have with a lot of medical shows, especially medical shows of this era, is that everyone's more focused on the gore and just how people look so drastically ill, but not how they manage the day-to-day sickness of a patient. And honestly, no, Cobra Kai did not do it better than this. I can't think of an example where it was a better ICU than this one, at least at this moment in time. I don't know if you can. I guess something
not offhand.
Good Doctor? No. Yeah, I would say Good Doctor. Good Doctor looked more realistic than this one. But that's also 20 years difference.
Yeah.
Yep. But that's like the big stuff.
Okay.
I still would recommend watching this show. The show's great. This episode's a heavy episode. Maybe start 2 episodes before so you can really figure out how bad everybody is and how hard it was for them to make the decision to report this pervert priest.
Yep. All right.
Not a super lighthearted episode.
No, not a fun-filled romp. Maybe next week we'll do something a little bit more light and fluffy.
I'll find something.
All right. Well, thank you, Jackson, as always.
Yep.
Thanks, folks, for listening. Like I said, if you're listening to this on the 16th of March, 2021, which is the day it came out, tomorrow we will be doing a AMA on Reddit at 10 a.m. Pacific. And on Saturday, the 27th, we'll be doing our Reddit AMA. Not our Reddit AMA, our WonderCon. Let me double check that date just to make sure.
March 27th, 5
March 27th, 5 p.m.
time. Cool. Details will be on the WonderCon website, also on the Comic-Con YouTube channel as well. You can watch it there. And then if for some reason you missed it, we'll have it on our channel that following Tuesday. Yep.
Cool. Well, thanks, folks, once again, and we'll be back next week.
Thanks so much. Bye.
Bye.